Welcome, everyone. We want to first thank you for joining us for ALS Canada's 2025 webinar series. Today, our focus is on organ donation and ALS. We are pleased to be joined by Dr. Andrew Healy, Janice Beitel, and Janet Taylor. First off, I want to introduce our presenter. So Dr. Healy is an emergency and critical care physician. He is a chief of critical care and a staff emergency physician at St. Joseph's Healthcare Hamilton. He also practices critical care at William Osler Health System. He is currently the provincial medical director for organ and tissue donation with Trillium Gift of Life Network. As an associate clinical professor at McMaster University, his current academic interests are around health system adaptive leadership, optimizing death determination, and donation transplant processes. Janice Beitel graduated with a Bachelor's of Nursing Science from the University of Saskatchewan and received her Master's of Science in Nursing from the University of Toronto. She has 20 years of experience in organ donation and is currently the Director of Hospital Programs, Education, and Professional Practice on Ontario Health Trillium Gift of Life Network. Prior to her work at Trillium Gift of Life, she held previous positions in critical care, clinical education, professional practice, and patient relations at Sunnybrook Health Science Center. Janice has participated in a number of national forums, research, and articles related to organ donation. She currently directs initiatives to support the work of donation in hospitals in Ontario, oversees the education for Trillium Gift of Life Network staff and healthcare professionals, and supports the donation physician program. And finally, we have Janet Taylor. Janet Taylor is a senior specialist at Trillium Gift of Life Network, working with patients, families, and hospitals to support organ and tissue donation at London Health Sciences. Janet's previous experience in critical care has contributed to her knowledge and skills. Janet has a special interest in supporting opportunities for donation with individuals with medical assistance in dying as part of their end-of-life plan. In addition to supporting those individuals, Janet mentors others, network specialists in the province in the area of donation. So I would like to welcome everybody to put their questions in the chat, and we will be ensuring to answer all questions towards the end of the presentation. So to get things started, I would like to introduce Dr. Andrew Healy.
I'm just going to share my screen here, and then we'll check and make sure that you can see what you're supposed to see. Okay. Do you see just the cover slide? Is that all you see?
Yes.
Okay, great. Well, what a privilege it is for me to be here today, and I feel especially privileged to talk about this topic with you, as much as I feel an edge of anxiety, to be fair, and I think it'll become apparent very quickly why that might exist for me today. So my practice of medicine is in critical care and emergency medicine, and my leadership role really centers in at Ontario Health. And I'm going to do most of the talking today, but I think Janice and Janet are probably going to be in the best position for you to answer questions. So that we're really sort of transparent at the beginning, that this talk is aimed at patients who are experiencing ALS or families who are family members or friends of patients with ALS. So when I talk about tricky topics and I talk about learning, I think about that as a little bit of an exercise in making a soup. And I think probably all of us have had the universal experience of enjoying a really delicious soup. That requires us to do a couple of things. Obviously, if you put a pot right in front of you and you just have cold water in there and you add vegetables and some other spices and you don't do anything with it, it's just cold water and soggy vegetables at the end of the day, and nobody really enjoys that. And so, in that way, not very much learning happens. Um, as we as we turn on the heat, if you will, we start to turn up the temperature of that environment. We get a little bit uncomfortable. We have to stir the soup to make sure that the flavors start to meld together. You start to taste the soup. You get the right feeling, and in the end, you're left with a very delicious meal. as long as the heat's not too high. And sometimes when the heat's too high, the vegetables in the bottom of the soup kind of burn, and you're wondering, is he ever going to land this helicopter and talk about ALS and organ donation? I promise I will. The reason I start here is that sometimes when we're listening to this, we're at different stages of our understanding of ALS as a disease or readiness to plan for end of life care. And I think from my perspective, it's incredibly important to give yourself permission to say, today, this is not for me. And on other days, you may come back to this very resource and find that this is exactly what I need at this time. So sometimes the heat will be too high for you, but I hope we get the soup right today. And I hope that you enjoy the presentation in a way that gives you the information you need to make good decisions um, uh, if those decisions are relevant for you at that time. So I'm going to talk about sort of five things today. The first I'm going to do is I'm going to tell some stories, some important personal stories to me, but also stories that might resonate with the experience that you or your family may also may be having today. The second thing I'm going to talk about today are a series of choices that lie in front of us when we think about donation and end of life care planning. The third thing I'll talk about is donation, deceased donation in general. What happens how does that work? Specifically in Canada, but also more specifically in the province of Ontario. Then I'm going to talk about what donation looks like after one might choose medical assistance in dying. And then I'm going to leave you with a bit of a story of a teacher and public health physician who really wanted to make sure that people understood what a donation after medical assistance in dying was. We'll watch a very short video, and then hopefully you can come to appreciate the information that you need at this time and how to move forward and what might be next for people who are thinking about this tricky choice, depending on the stage of life they might be at. So let's start with stories. So in the story, you'll see the woman in the pink shirt on the floor who's reading the story is named Claudette. She's my mother-in-law. My father-in-law is exhausted by his 11 grandchildren that day for sure. And my mother-in-law loved to read stories to our children. So I took that as a permission today to introduce you to her because she has a very significant relevance to the story, at least in one aspect of it. And of course, she was somebody we loved in our life. This is a picture of Claudette when she found out that I was going to ask my wife to marry me. So it's a long time ago now. We're married almost 25 years. And this is so Claudette was a very, very active person. And you'll meet her throughout the presentations in different ways because I still see her as giving me advice very frequently, particularly as it comes to my work in this space. On the left-hand side, you see her holding our firstborn. On the right-hand side, you see her being screeched in. That's with her husband, and my wife is the third person in there. The screeched in is a process where you become an honorary Newfoundlander. Living life to the fullest in this moment would be a fairly important description. We used to make fun of her for how active she wanted to be because we would say this morning we're going snowshoeing, this afternoon and we'll probably go cross country skiing, and in the evening we're considering a marathon. So always very active, and you can see lots of children around. Those are all Claudette and Eric's grandchildren, and several of mine. This is shortly after the beginning of the pandemic, in the spring of 2020, when Claudette learned that she had ALS. And Claudette learned that in about April of 2020. This is our kids on the back deck of our home during April, which is Organ Donation Month. You'll notice we're all wearing our appropriate green, even if we might have had to struggle to get there. And this is a picture of them during their wedding anniversary. Claudette and Eric were very, very active members of the ALS advocate community. Some of you may even know her. And you'll see that she spoke at conferences, was on lots of advisory boards, and certainly helped us understand this disease in a way that I would never have understood it as a practicing physician. And in the center there, you'll see that she enjoyed many aspects of her life when even though she was living with the diagnosis of ALS. This is a picture of our family reunions, not so long after the original pictures that you saw there. And this is my son Caden learning to bake apple pies. There's no better apple pie than what you'd see in this picture. So Claudette lived with ALS for about 5 years and died in March of 2024. Um, Claudette really deeply valued organ donation, and I'll share with you why I know that for sure in a moment. But she understood that medical assistance in dying was not a choice she wanted to make. She wanted to live as long as possible and enjoy life as much as she could. She didn't want to be debilitated to the point where other people would have had to care for her in a really intimate way. And she also didn't want to have to make a choice about medical assistance in dying, although she had explored that quite in detail. And she had an experience during her disease where she went to a webinar, probably not that dissimilar to this one, where she reflected to me after that it felt like the webinar was an advertisement for the end of her life when she wasn't ready for that. So it's really important for me that we land this in the right space that respects that medical assistance in dying might not be a choice that you might make. And for Claudette, that was really clear. And Claudette died at home in her sleep after little bit of an anxious evening, but one that was spent with her husband, and peacefully went to sleep and died at home. Too soon for all of us, probably at the right time for Claudette, given her symptoms at the time, and in the right space for her. So she was a woman who held the value of donation and the value of her death very deeply to her heart, but understood that because of her choice in end of life care, donation was not going to be possible for Claudette. And that's a really important take-home message here that sometimes you will make a plan for the end of your life, whether it's with ALS or some other disease, that does not allow donation, and that's okay. You will weigh and make the right decision for you. This is a picture of my son at Carnegie Hall just a couple of weeks ago. He is a violinist, very accomplished violinist, and you'll wonder why I'm showing you pictures of my family. That'll become very apparent in just a second. So this is a picture of my son and his living organ donor. So Caden had biliary atresia when he was born, and then developed cirrhosis and required a liver transplant at 4 months of age. And so Michelle, Claudette's daughter, and my wife was the living donor to Caden. In the next slide, you'll see pictures of Caden around the time of transplant, and I think it reflects for me, the connection between why Claudette deeply valued donation and could hold that value deep in her heart, but also value the plan for her end of life care did not align with that. You see a picture of Caden playing the violin there. Maybe you hear a little bit of background violin music, and this is when he was very sick early in his life. And the picture in the bottom center is when Caden was just a day or two post transplant and doing exceptionally well. And the picture in the top left is just a couple of days before. So the benefit of organ donation is not lost on anyone, but is often not what drives our thought process as we plan the end of our life. That's often about legacy leaving and gift giving. That's really important in making meaning out of the end of our life. But the recipient side is a wonderful one. Without donation, living donation in this case, Caden would never have played at Carnegie Hall, and we would not have learned the many things we've learned about raising a teenager, which I'll save for my therapist in another webinar. So this is a picture of my family, just to briefly speak about the fact that, in my own family, I have a donor, Michelle, and a recipient, Caden, but that doesn't actually rest where my motivation for making sure that this works. And this is also true of Claudette. Claudette valued deeply, as I said, the gift that donation was able to give us, but also what she wanted at the end of her life that wasn't consistent with that. So we'll just take a breath and understand that doesn't end the teaching that will come from the life experience that we've had over time, but it does often land in a different way for each individual. And remember that no matter what place you're at, Hopefully, you get from this experience the information you need to think about how we move forward with organ donation in the context of ALS, which unfortunately is a terminal disease. And hopefully, you get enough information here that allows you to think about incorporating donation, if that's important to you, into your end of life care plan in a way that's as seamless as possible when it's time for you to think about those things. So lots of people make lots and lots of choices in our life. And when I was thinking about that, I also was reminded about lots of choices that Claudette made to live her life in the fullest, even with the disease, and even when she was quite symptomatic with the disease. Um, but as we turn to thinking about end of life, because donation in this circumstance occurs after we die, um, one has to think about what choices lay ahead for us as we think about the experience of end of life. And as I've said a number of times, everybody will be at a different position to think about and learn about what that might look like. There are a lot of choices that exist, but specifically the choice that I would like to just briefly speak about is that choice about how one might choose what's important for them at the end of their life and how it relates to donation. So, like in Claudette's case, you may choose, although no one would choose to die at this time, you may choose that death at home or in hospice or in hospital without intervention and a focus on symptom relief through palliative care might be how one chooses to die. If that is, if that allowing of natural death occurs, um, we can't predict the timing of that. That occurs in an uncontrolled fashion, often very comfortably, in a circumstance that would not permit organ donation. If in as many people with ALS and other degenerative conditions and organ failure pick, one might pick medical assistance in dying in conjunction with your healthcare provider. That's a circumstance where medication is administered to induce sleep, and after someone is deeply asleep in an anesthetic way, the heart is stopped in a planned and intentional way, and that happens either at home or in hospital. In Ontario, if you choose this at home, sometimes we're able to facilitate lung donation after medical assistance in dying. We've been able to do that successfully a couple of times. Everything sort of has to line up, but if one chooses that to be at home, lung donation is occasionally possible. If you choose medical assistance in dying in hospital, then the breadth of organ donation that you are able to fulfill for yourself would happen. It could happen, and I'll talk about what gifts can be given in that circumstance in a bit. But certainly, other organs are possible to donate, and this type of death happens in a planned way, an intentional way, a way where you offer control over the consent, timing, and experience, and where we would provide the expertise to ensure that that journey is navigated in the way you want to allow donation of your organs. The last thing I will say before I go on to talk about donation in general is that it is critically important to make space for uncertainty. And our specialists, like Janet, regularly work with patients and families through that uncertainty about what's next. What are we going to do and when? And those choices will fluctuate. They absolutely will fluctuate. Um, as time goes on, people's experience of the disease changes, people's desires or wishes or understanding of what their end of life care might look like, and they're working with their physicians about their symptom relief and their treatments on an ongoing basis. And so uncertainty is more the rule than the exception. We are here to walk with you in that journey in a way that's right for you and your family, if this is something that you're interested in. There's no question donation is a powerful experience for everybody whose lives have been touched by it. We often say that one organ donor can save up to 8 lives. In this circumstance, that would be incredibly rare. But certainly, the gift that you do by touching even one life is evident, I hope, in the examples we've even shown today. So when we think about why people do organ donation in general, why would people choose to sit there in the space of organ donation where, as a specialist like Janet or as a leader like Janice, lots of people would say, you're working only with families of patients who are going to die. Why would someone choose to work in that space? And the why is right at the center for us. This is a quote from uh, Emerson Kern's father. Emerson died as a result of a trauma in Western Canada, and he was the editor of his father was the editor of the Ottawa Business Review, and so he wrote quite eloquently about Emerson's experience of death and subsequently donation. And shared that in this time of absolute despair from the senseless killing of his son, this was a glimmer of hope. This centers the experience for donation providers about where we are at. Everybody would want something good to come from tragedy. Everybody would want us to honor the wishes of those people who are dying and the families to feel as though those wishes have been satisfied. And almost as a side effect, but in many ways, a legacy leaving is the fact that recipient lives are actually saved through that gift. We don't have a lot of control over whether transplant happens. The control you have is over whether you wish to move through the journey to try. And that is an enormous gift to the system. We also understand that this sometimes feels like a tragedy, and that the experience of grief and loss that your family will experience, um, it feels unusual to think about a light in the midst of that. But some people who have been able to speak to us through a very long journey talk about this being a light in that journey. And so this is just another perspective for consideration. Um, Deceased donation in Canada usually occurs in a critical care environment. So it usually occurs in an ICU for a patient who's on life support, usually unexpectedly. They have a long period of active care, usually, or at least a significant period of active care. And after that active care, there's a period of prognostication, meaning we try and predict whether people will be able to recover to a level of function and ability that would allow them to live in a way that's acceptable to them. Sometimes that choice is not ours. So sometimes, beyond prognostication, someone dies of death by neurological criteria or brain death, as you might have heard it. And those people have loss of all of the function of their brain, and that can't be restored. Those people are considered to have died and have. And they go on to have donation in an operating room with their heart still beating. And so all of the organs are possible to donate in that circumstance as long as it's safe and sufficient to do so. The other way in which donation occurs, and this is how donation occurs after medical assistance in dying, is when someone has a life-limiting illness where a decision is reached to withdraw life support. So you might be on a ventilator, or one might be on a ventilator and other supports, and the family, most commonly or occasionally a conscious and competent patient, will say, I don't want this anymore. I want to be made comfortable and be allowed to die. And in that circumstance, you have withdrawal of that care after a workup period and some time to think about donation. And you proceed to your heart stops prior to going to the operating room. The brain function also stops, and you have non-heart beating donation. And in that circumstance, we call that donation after death by circulatory criteria. And that type of donation needs to happen very, very quickly. So with brain death, we have more time to get to the operating room. The organs are still perfused, but in the other type of donation and after medical assistance in dying, we take the patient very quickly to the operating room where the surgery is performed to recover the organs before they're damaged. So what does donation after medical assistance in dying look like? And this was essentially a function of law that came into effect in 2016. And we as an organization, I'm really proud to say, along with many of the people that work with us, and eventually the Canadian community, um, we're able to offer donation to people who have undergone medical assistance in dying very early. Um, the important things to think about in this circumstance are that the timing of thinking about when you introduce a conversation, once you've decided to move towards medical assistance in dying, um, when do we think about donation? How far ahead and where? So we've already talked a little bit about location. If one chooses medical assistance in dying in the hospital, then more organs can be given as gifts at the end of life. And if one chooses organ donation at home, at least in Ontario and not in very many other places, if any in Canada, so one can sometimes donate their lungs. Certainly, if donation is really meaningful to you and dying in hospital is something that you can entertain, that will allow you to maximize your gift to other people through that process. One question is where you want to die. Another question is if you want medical assistance in dying. If the choice is medical assistance in dying, then donation can be discussed. If the choice is to allow natural death at home or in hospital or hospice, then donation is not something that's going to land within your end of life care plan, even if that is a value you hold deep in your heart. And the question of when it's most appropriate to entertain donation, the best advice that I can give is with enough time to incorporate it into your end of life care plan, and with enough time to work with an expert like Janet, who could give you all the information you need to make the right decision about organ donation in that circumstance. You want to do that not right before you have medical assistance in dying, and most people would say that after they've chosen to get approval for medical assistance in dying is usually when they'll raise the topic with their healthcare provider, or their healthcare provider will tell them that they've been referred to Trillium Gift of Life Network in Ontario, where somebody will speak to them, an expert in donation. So I don't do that conversation actually. Janet does it, and Janice teaches people to do it. And so that conversation and that working with the family is a special skill, and we're really lucky in virtually every province in Ontario to have people who are dedicated to that role. But specifically in Ontario, we're very lucky to have specialized nurses who work with patients in this experience and make sure that all the information you need in the process is provided. So I'm going to lay briefly out for you now the process of what this looks like practically speaking. So once someone has made a decision to seek medical assistance in dying and has received at least one approval, if not both approvals, there usually will be a time where the medical assistance in dying provider will refer that patient to the organ donation organization, such as TJLN in Ontario. Um, that referral occurs, and then the provider will usually work with a specialist like Janet to speak with the patient and family and whoever they wish to have present for their support at a time that's right for the patient. So sometimes we get a referral from a provider where we would discuss with that physician or nurse practitioner who might or coordinator who might say, we understand that this is something that they want to think about, but they're not ready to have the conversation. And then, the specialist will stay in touch with the provider, or they'll speak briefly with the patient and say that this is something that they want to consider, but the timing is not at this moment. And so additional time is provided, and lots of different connections can occur over a period of time. There's certainly, as long as there's time prior to the provision of medical assistance in dying, there is time to discuss donation on a number of occasions. Those specialists will give patients and family the information you need to make a decision and will help you make the decision that's right for you. There's time for reflection. And importantly, once you decide, there's time for what we call a medical social interview or a donor risk assessment interview. And that allows the specialist to make sure that We have all the information about your medical history and your social history in order to inform the risk assessment for taking an organ from you after you die and putting it in somebody else. We want to make sure that that is both safe and that the organ function is normal. So, in order to do that, patients have to undergo some testing. There's different approaches to that. Sometimes patients will choose to go to hospital. Um, and sometimes we can coordinate almost all the testing to happen right together. The testing usually always involves extensive blood work, and then involves sometimes an ultrasound, sometimes a CAT scan, frequently an X-ray, and then what the blood work and testing allows us to do is assess it allows the transplanters to assess, is it safe and will it be effective to transplant an organ, and then match that organ to an appropriate recipient. That process can take some time, and certainly our specialists are excellent at doing that. And occasionally, depending on the circumstance, we're able to offer some of that testing at home so that it is truly patient-centered from a donation perspective. Once a time and date has been set for medical assistance in dying, and those individuals are, and all of the necessary information has been gathered, one would have their provision of medical assistance in dying, usually in hospital. After that happens, the heart stops and the breathing stops, and the doctors declare death. And following that declaration, um, donation, when it's possible, happens in the operating room with the skilled transplant surgeons who will recover those organs and bring them back to the transplant center. When we think about which organs can be donated in this circumstance, um, so lungs certainly are an option as long as there's not infection or damage to the lungs. Kidneys are frequently donated in this way. The liver can also be donated, and sometimes the pancreas. And we haven't done this yet, but at least I don't think we have. Um, the Eventually, we will be able to obtain hearts in this circumstance, and you'll be able to one who chooses medical assistance in dying would be able to choose to donate their heart to another individual, and that can be recovered onto a machine, and made ready for transplant in another person. There's something that's really tricky in this circumstance, along with lots of the information I'm giving you. That trickiness is that sometimes you have given us your consent for donation, and sometimes that doesn't work out. And that can be challenging for sure, challenging for everyone. We do our best to predict which patients will be able to give which organs and give that information to the people who want it at the time we have it. Um, but sometimes that it doesn't work out. Sometimes we discover that there's a disease that would be transmitted, or there's a recipient issue. It's not uncommon for that to happen. The most important thing you should understand from us is that the gift you've given us here is the consent to try to help other people. And that, in and of itself, is a legacy that everyone should be proud of. So, what do we do next? We've talked about choices, we've talked about some stories, we've talked about the process of organ donation in a bit of a medical and technical way. What do we think comes next in this circumstance? Well, this is where that advice from my mother-in-law still is ringing true in my head. So, thinking about this as what's right for you and what time might be right for you, she's smiling back at all of us at the moment. So, there are three pieces of advice I'd like you to take away from this portion of our interaction. The first is when you're ready or you need to plan your end-of-life care, talk to your healthcare provider, be that your doctor or nurse practitioner, or if you've engaged in the MAID process, your MAID coordinator, and ask your doctor to refer you for organ donation if you're going to choose MAID. You should do that even if you're not sure, because our specialists will give you the right information about this experience and will be able to help you understand what that journey might look like for you. And when you're ready, our specialists will be here, like Janet, to speak with you in an expert, kind, considerate, and patient-centered way that allows you to have the information you need. Now, there's another teacher we're going to turn to for a moment. That teacher's name is Shelley Sarwal. She did not have ALS, but she did have a degenerative neurological condition. And she felt it was really important to teach other people about what medical assistance in dying and donation might look like in somebody who could predict the end of their life with medical assistance in dying. So I'm going to play a very short trailer of this movie so that you can understand at least a little bit about Shelley's perspective in this process.
Hold it. Breathe, but don't move. Nice and still again.
I wish we could go back to accepting death as just a natural part of life.
Big breath in again. Hold. Excellent. Breathe away.
I was just diagnosed with multiple system atrophy. Parts of my brain are atrophying, they're just wasting away.
She had already known that whatever's going on was not reversible. I don't want to think about what it's going to be like without her.
For some people, having lost control by knowing they're dying, having that choice on how and when you die is the one piece of control they get. MAID has become an option.
I'm not looking at MAID as just as a way to end my life. To me, it's a way of ending my life at a time when I'm ready and how I want it.
She wants to be a pioneer in doing the organ donation and trying to make sure that she can inspire others to do organ donation.
I've spent my life trying to help people, help patients, improve the medical system. That part of me just doesn't turn off.
When she was presented with the opportunity to do this, to be a pioneer, to be a teacher, she took it on.
Organ donation to me is the easy decision. I could save, I don't know, 5, 6, 7 lives. It's hard for me to say no to that.
She wants to prove that she can do or still do X, Y, and Z. And that she doesn't want to give those things up. So it's her way of fighting, not giving them up.
I don't want my legacy to be a thing. I'd rather that it's what's in people's hearts, how they remember me, and the way I live my life.
So Shelley had three lessons for healthcare providers. The first was get comfortable talking about death. The second was stop talking about death as a failure. And the third was to treat the living as a living. And I hope that we've honored all three of those things today in a way that is meaningful for the people that need or want to hear this message today. So we've done some storytelling. We've given you the context by which my personal experience might lead to some people's might lead to an assessment of what this experience might look like. And we've learned different perspectives on donation, medical assistance in dying, and the context that those might that those might hold for someone with ALS or a family of a patient with ALS. The second thing we've talked about today is some choices. We've talked about the medical aspects and the giving aspects of organ donation. And we've talked about what medical assistance in dying and organ donation might look like and how you might explore that at the right time for you. And I hope that through generating the different perspectives and the different stories in this circumstance, we have been able to share the right amount of information for you. I I think that it would be impossible for me to end today without saying that today, in my view, really honors the lives that you and your families live, the gifts that you might be considering, and the beautiful and loving memories we hold in our heart of Claudette. So thank you very much. I'm just going to invite Janet and Janice to see if there's anything they would like to share. I did pretty well there. I got to the last slide. I thought that was pretty good. I'm going to stop sharing now and see if Janice and Janet want to add anything or correct me for anything that I might not have gotten right there.
No, I don't have anything to add. Andrew, I'm interested in hearing from the people that we're hoping that we've answered some of the questions, and we're interested in hearing what other questions they have. But Janet, did Andrew miss anything?
Not at all. He makes me so proud. I'm
There
very
you go.
happy. Yeah. And
Well,
made
thank
it
you very much for
personal,
saying
which
that.
is a nice thing as well.
Yeah.
Thank you, Andrew, for that presentation. It's been great. We do have a few questions that have been asked, so I will go ahead and kind of go through those. The first question is there an age limit for organ donation in Ontario and other provinces?
Yeah. So, do one of you want to take that, Janice? Do you want to take that question?
Yeah, go ahead, Janet.
Oh, I thought you said Janice. The age in Ontario is 75 or younger for organ donation, but you can also help through the gift of tissue donation up to the age of 79 and 364 days. So we can still use your eyes for research and teaching. If you have ALS or if you have another disease, then we can work through what's accepted and not accepted.
Perfect. Thank you, Janet. I have another question. So, if an individual living with ALS is in hospital with pneumonia, which then directly or indirectly leads to their death, how likely will it be that their lungs are usable for donation?
So if you have pneumonia, depending on the nature of what that is, because pneumonia is there's a very large spectrum of that disease. It makes it less likely for the lungs to be used for sure. And if there's active infection, we don't use that particular lung. But that doesn't mean that, a kidney or a liver might not be able to be donated in that circumstance. So it's an individual decision made often at the time that somebody has medical assistance in dying, or if they were in an ICU has withdrawal of life support, and it's often a little tricky to make that decision, and we leave that to the transplanter to make that decision.
Thank you. Will elevated liver enzyme levels from ALS meds eliminate at screening, or would there be a conversation about stopping medication at some point?
Oh, that's really interesting. I think the first thing is usually those abnormalities are pretty minor, and so they usually don't impact a decision to affect donation. The liver is the most sensitive organ to low oxygen and low blood pressure, and so it tends to be the hardest organ to sort of facilitate donation following medical assistance in dying, to be honest. But I don't. I mean, it is a really interesting and centered question when you're moving towards the end of your life. Would you consider stopping a medication to improve a chance for something else? It's certainly something that if an individual had a question about, we would try and seek the answer for, but I suspect it wouldn't be necessary. And I think the best thing to do is to have the care that you need at the time you need it, and then when you're ready for donation, we'll assess it and do our best. But that's such a generous and interesting question. I don't know, Janice or Janet, if you have other insights on that.
I was just thinking if the meds are for comfort,
Yeah,
then I wouldn't want to take that away at all.
right.
Your comfort as an ICU nurse, as Janice will attest to, comfort is paramount to us. So they would take into consideration the medicine that you're on, and the transplanters would realize that some of them do affect your liver, and they would take that into account. Whereas if you took your liver and put it into someone without ALS and ALS medication, then they would take that into consideration as well.
Thank you. So another question has come in. How does one donate other parts of their body to science research? Would that be a conversation that you would have if organ donation isn't an option?
100%. Yes. So if organ donation is not an option for you, then we can look into donating your body to science, and we can help you facilitate the letters and things like that to the universities around you. And we can help make phone calls to see if they are taking donation of bodies after death. So that's something you can still donate your eyes and be their body to science. So, but organ donation, if you have organs taken out, you will not be donating your whole body to science. But you'll be helping to save lives. So, in that way. Anything I missed there, Janice?
No, I think that you've answered. Really, what we're trying to do is assist you in providing the gift that you want to provide at end of life. And we often work with you to determine which gifts are possible.
Thank you. Is there any resources for families whose loved one decided to make this choice, specifically looking at emotional resources?
Janice, do you want to take that?
Yeah, we do have a aftercare program, and what that enables us to do is provide some support and continuity. It may not be the type of grief support that or bereavement support that we might have in other circles, but there is the opportunity to connect in and understand at a later date how the recipients are doing. And people can write anonymously in Ontario to the recipients, and the recipients can write anonymously back. That's something that can be facilitated. And so there is touch points after the donation. And I know that Janet, and as a specialist, when she works with individuals who decide to proceed with donation following MAID, of course, there's in touch with the families to help them understand who they were able to help. And that's the important part of involving your family members in the decision. If you'd like your families to have that information, we need to know about that at the time when we are working with you related to the consent and through other details. That's something that we'll ask you. Who else would you like to know about, or ensure that has access to some of the information about where your gift has been and who they've been able to help? Janet, did I miss anything there?
No, I was just thinking though, if confidentiality, if you didn't want your family to know that you were an organ donor, we can do that as well. We can make it as private and careful as possible. Obviously, we can't control social media, but we do value confidentiality either way. Even if you didn't want your family to know that you were thinking of MAID, I don't have to speak to your family. I'll just speak to you.
Right.
That's important, Janet. Thank you.
Yeah. Yeah.
Perfect. Thank you. So I have two more questions here. Is there any costs associated with organ donation?
Excellent. No, so we work within the healthcare system, and the testing for the healthcare system is done within the healthcare system. We work to try to ensure that there aren't costs. So if, for example, you need to go to an outpatient lab, or if you need to come to a hospital, for example, for a test, our specialists work with you to determine if assistance is needed, paying for that parking costs or travel costs. And we try to ensure that there are no additional costs because of people's generosity and decision to donate.
Thank you, Janice. And another question, and I believe, Andrew, you might have touched on this. Can tissue donation be done with MAID at home?
So it can be, but tissue donation for transplant isn't possible in ALS, but eye donation for research and teaching so that people learn how to do corneal transplants or eye surgery. That's a really important thing that people do. And so we can facilitate that if you choose to die at home. That's not a barrier usually.
Amazing. Thank you guys so much for sharing your expertise and answering these questions. And Andrew, thank you for your presentation. It's really impactful and answers a lot of questions that I know our community has. And so we really appreciate that. And so to everyone who has joined us here today, as you leave, we wanted to let you know that there will be a survey as soon as you exit out of the presentation, and it just gives us a little bit more information so that we can prepare for future webinars. So please feel free to share your thoughts and your opinions so that we can have that information. As well, we will be having the sessions recording up on ALS Canada's YouTube page, and that will be available for individuals to watch back or be able to share with their loved ones, share with family members to be able to kind of start those conversations. If there's any additional questions, please do not hesitate to reach out to ALS Canada, whether that is your community lead or directly at communityservices@als.ca, and we can share additional resources. Again, I want to thank everybody for joining. Andrew, Janet, and Janice, thank you guys so much for your presentation today and answering our questions. And we look forward to seeing everyone at the next webinar. Thank you, everyone.
Yeah.